Hello everyone, and welcome to this week's disability information video. This week we're going to be talking about multiple sclerosis, and before I kind of leap into discussing the kind of symptoms of multiple sclerosis and how it affects an individual's life, I want to talk a bit about kind of the scientific background and exactly what's going on behind the scenes with multiple sclerosis, because that'll help me explain the symptoms of multiple sclerosis and how it's expressed in each individual. To understand how MS works, we need to understand a bit about how a neuron works. So a neuron is kind of the basic building block of your brain and nervous system. It's basically a cell that when it fires, it communicates a message to other neurons. So basically your whole brain and nervous system is made up of billions of these neurons. In fact, science has shown that there are around 86 billion neurons in our body, which is more than the stars we can see in our galaxy. So there's a lot of neurons in your body, and they're all communicating with each other basically by this simple on-off switch. So basically a neuron fires and that sends an impulse to other neurons, which allows them to communicate with each other. So what I want to emphasize before moving on into the next section is that this description of neurons is pretty simplistic. So if you want to learn more, I've attached an article in the description of this video where you can go and learn more about how neurons work, because it's very foundational to how your brain works and how basically psychology in general works. So I would encourage you, if you're interested, to go check out that article. And now moving on into how multiple sclerosis works. So multiple sclerosis involves an abnormal response of the body's immune system, where the person's immune system basically mistakenly attacks the body's central nervous system. So your immune system, which is supposed to help you combat diseases and infections, accidentally, for some reason, scientists aren't sure why, it begins to attack your nervous system, which is the way your body communicates with itself. It's what we just talked about with all the nerves, where when they fire, they send messages to other nerves. So it basically, the system that's supposed to help you prevent disease and infection begins to attack the system that helps your brain communicate with your body. So the way it does that, the way multiple sclerosis works, is basically the immune system causes inflammation that damages myelin, which is a fatty substance that surrounds, insulates, and protects nerve fibers or neurons, as well as nerve fibers themselves and the cells that make myelin. So as I just said, it's attacking your nervous system. So what happens is that the damaged areas develop scar tissue, and that gives the disease multiple sclerosis its name. So multiple, meaning multiple is self-explanatory, but sclerosis it basically means scarring. So what you should think of when you hear multiple sclerosis is just multiple scarring. So it's the scarring of these nerves, which send impulses that allow your brain to communicate with the rest of your body. So when this scarring occurs, basically it impacts the ability of your brain to send signals to the rest of your body. It makes it more difficult for your brain to do that. So that means that neurons that used to be able to send signals to each other can no longer send signals because the nerve is scarred, so the signal is prevented. So, for example, in a neurotypical brain, in other words, someone without multiple sclerosis, I can come up with the idea that I want to move my arm right now and do it. So, for example, I just go like this, and that's my brain up here sending nerve impulses through my spinal cord and to my arm, telling it to move. But for someone with multiple sclerosis, this pathway is disrupted. So they may be able to form the idea, I want to move my arm, but because the nerve connections are disrupted, that impulse from your brain will not be able to travel to your arm and tell it to move. So you end up not being able, your brain ends up not being able to communicate as readily with the rest of your body. So now we can move on into a bit of symptoms because we know how multiple sclerosis works. So what I want to emphasize in this part is basically the fact that because we have so many neurons, as I said, we have around 86 billion neurons in our body. Because we have so many, MS affects everyone differently depending on which specific neurons become unable to communicate. And the symptoms can even change from inside a person over the course of their illness. So the symptoms that affect someone at the beginning of their MS journey may not be the same as the symptoms that affect them later on. They can change over time depending on which neurons are scarred and which communication is allowed to actually persist and which communication is prevented. So some more common symptoms that are, as I said, more common for people with MS include something called an MS hug, which is one of the most common kind of indicators that someone might have MS right at the beginning. People often experience this MS hug, which essentially is a squeezing sensation around your torso, so around here, that feels like a blood pressure cuff when it tightens. So a blood pressure cuff is what they have at those pharmacies, which you put around your arm, and it kind of pumps full of air and puts pressure on it in order to detect your pulse. So that kind of pressure feeling surrounding your arm is similar to the feeling you get around your torso when you have MS. So that's one of the more common warning signs that someone might have MS. And some other common symptoms also include things like numbness or tingling, weakness, fatigue, walking difficulties, or involuntary movements. But what I really want to emphasize to everyone is that, once again, everyone with MS is going to have different symptoms depending on which nerve connections are disrupted. So you can't just come up with a stereotypical version of MS because it really affects everyone differently. And the central thing that makes it be considered MS is the central, as I discussed earlier, the scarring of nerve tissues, or the scarring of neurons, which prevents the communication between your brain and the rest of your body. So I think now we have a good enough understanding of MS to move into the next portion of our video, which will be an interview with someone with lived experience with MS. I'll see you in that portion. Hello everyone, and welcome to the second part of this week's disability information video on multiple sclerosis. Joining me this week is Norman, who will give a bit of insight into a bit of lived experience with MS. So Norman, thank you for joining me today. The first question I wanted to ask you is, what are two aspects of your life that MS affects that other people might not know or think about?
Okay. First of all, most of the people with MS, the fatigue level is very high, and like for me, I'm such a big guy, and people will think I'm very healthy, but for me, because I always have to, even in the afternoon, I feel very fatigued, so I need to take a long nap in the afternoon always. So that's why it's stopping me to find a full-time job. It's similar to the patient with severe fatigue symptom. It's pretty much the same. And the other aspect is for MS is, for me, is affecting my mobility, motivation, but it also affects other of my body health issues such as constipation, urine problem, and depression. So it causes a lot of other health issues. So because of that, for me, I'm not only visiting my neurologist, so I have to visit all kinds of specialists like psychiatrists and urologists and so on.
Yeah, absolutely. It would be difficult to manage when your fatigue levels are so high. And I can imagine how that would make it difficult to kind of get a full-time job. But I'm also glad that there are specialists out there to help you. But yeah, I can imagine how that would be difficult. But with that in mind, so taking into account some of the challenges, what I wanted to ask you is what have been two of the most important things for you in sort of managing MS? So managing some of the challenges that you mentioned.
Mm, for me, actually, I think one of the good things that I'm still able to move. So I keep on doing exercise every day, even though they are not aerobic exercise. At least I can move my arms and move my legs a bit and try to motivate myself a bit. And I recommend for other people because there are other people worse than me. So even if they are not able to move physically, at least they can do something like meditation. They can just relax, sleep, and then try to think in mind. That's what I recommend. I have my MS friends who do a lot of meditations too. And the other thing is try to get more involved in the more social activities, such as doing volunteers. And even if you're not able to go, at least you can talk to a friend or invite your friends come to have dinner or lunch. At least have more social activities. I believe that will help too.
For sure. Yeah, no, I think it is very good advice to kind of try, to the best of your ability to try to keep active in some way. So, for you, maybe it's being able to move your arms, but if someone has more of a severe condition with MS, then, maybe they just meditate. So I think that's very good advice to kind of, no matter how hard it is, you just try to do something to keep yourself going a bit to the best of your abilities. So I think that's very good advice. Now, what I wanted to ask you next is what sort of things really make your day?
What really made me to think positive is after I diagnosed with MS, actually after that I received a lot of loves and care from my friends, relatives, and of course my family. And because I have MS, of course I'm having difficulty to move, and people don't think of me as a handicap. They try to help me. They try to help me to, for example, help me to think positively, and to give me more confidence and more support. Is what they do instead of turning me down always.
Yes, absolutely. I can imagine how it would be very important to kind of receive that support from your friends and family when you get a diagnosis like MS. And I can imagine how it'd be very positive to have that support. So I'm glad you kind of have that network, and other people out there, I also hope that they have their social network to kind of support each other. So my final question for you today, Norman, is with everything that we've sort of talked about a bit so far, what would be some words of empowerment or encouragement that you would give to people experiencing MS, as someone who has a bit of lived experience with it?
Okay, so for me, what I'm thinking is because I do try not to stick with MS is multiple sclerosis, but for me, I always translate that to many smiles. So always try to get more positive thinking, because I need positive feedback, right? So try to think of it as many smiles, not multiple sclerosis. And I know that all the doctors are working hard on it. So as I mentioned earlier, so I'm trying a new drug a few months ago, and the doctors are studying very hard to get an improvement. So yeah, I know doctors and a lot of societies are helping too. The one in Canada is called the Canadian MS Society. That one also offer a lot of helps, not only physically. They provide us not only financial help, but mentally help, and they also give you recommendations too. So yeah.
Absolutely. I think that is great advice to kind of maintain a bit of a positive outlook, regardless of what you're faced with. I like the motto, many smiles. I think it's good to, always keep a smile on your face, and maintain, that hopeful, positive outlook. So I think it is also good that, I'm glad they have these societies out there for people, there's other people out there who have experienced this, and they've created knowledge and resources to kind of help everyone else along their journey. And I'm glad that you could be a part of that kind of knowledge sharing today. So thank you very much for joining me, Norman, and sharing your insights.
Thank you.
Yes. All right. Well, have a great day, and thank you to our audience for joining us this week. I hope you join us for next week's video. I'll see you then. Goodbye.